Light glares appear outlining the Healthwatch Leeds logo and zooms into a wormhole. The screen fades from blue to black and the Healthwatch Leeds logo reappears. Yellow text emerges that reads "See things differently." The screen switches between two women as they speak.
Hi, my name's Alison.
My name's Jane.
We are two of the
5,500 people registered in Leeds with visual impairment.
visually impaired people have lots of challenges and difficulties in their daily lives.
Jane has received a letter. A caption reads, 65% of participants of our survey didn't have their communication preferences asked or met. The visual simulates severe loss of vision, given light perception only. The caption reads, this is similar to what Jane can see when receiving an appointment letter. Jane puts the letter down and calls her mum. The caption reads, Jane often relies on her mum for personal assistance.
Can't come for 2 weeks. What happens if I miss my appointment?
In this clip, Jane is unwell and is calling her GP.
Hello, this is GP surgery. How can I help?
Oh, hi. Can I get an appointment, please?
The caption reads, health and care organisations should ensure people's communication needs are met.
Can you send me a text confirmation, please?
Yeah, that's absolutely fine, and that should be with you any minute now.
That's lovely. Thank you.
Thank you. Bye.
Thanks, bye.
Jane is crossing a busy road at the traffic lights. The caption reads, there is a lack of support when attending appointments. She walks with her cane towards a bus stop. Jane can only see a vague outline of the bus stop, which is recreated on screen. In a new scene, Alison is getting out of a taxi and is struggling to find the direction of the entrance. The caption reads, it is difficult for visually impaired people to find and use public and other forms of transport and finding the right entrance. She walks through the entrance of the hospital and cannot make out any of the signs. An effect shows what it's like to have loss of central vision, common in congenital sight conditions and age macular degeneration. In another scenario, Alison is greeted by a volunteer in the hospital entrance.
The hospital told me that you needed help finding your appointment, and so I'm here to direct you.
That would be great, thank you.
Our caption reads, additional support would help when attending appointments. Alison is trying to find the eye clinic. She looks towards the signs and heads in the wrong direction. Caption reads, some people said signs in hospitals weren't clear, which makes it hard to navigate. A simulated eye condition replicates what Alison can see. A caption reads, total loss of peripheral vision, tunnel vision, common in retinal pigmentosa and glaucoma or a form of brain injury. This is similar to what Alison can see. A volunteer walks out of the eye clinic and catches up to Alison.
Hi, my name's Gemma, I'm a volunteer. Are you lost at all?
A caption reads, visual impairments vary in severity. Some people are able to read bold signs, such as black on yellow or black on white. If they have severe sight loss, there needs to be a different way of getting around hospital. Jane is pouring water from a kettle into a mug. A caption reads, some people who are unable to access support said that they were struggling alone or relying on family members for help. Jane pours too much water into the mug and it overflows. A first-person perspective appears on screen. It simulates the caption, patchy vision, common particularly in diabetic retinopathy. Text reads, people need to be made aware of the help available. Jane successfully pours the water with an aid on the mug. Alison is walking through a hospital waiting room. A simulation replicates her perspective. The caption reads, cataracts, hazy vision with scatterlight and glare. Alison fills around for a chair and sits down. A caption appears reading, Healthwatch Leeds recommends the following. Comply with accessible information standards. Ask people for their preferred communication method. Make accessible information standards and sensory impairment training mandatory for all staff. Use appropriate clear and bold signage. Use volunteers to help with attending appointments. Reduce waiting times for support. Let's work together to make health and social care services accessible to everyone. Screen fades to black, a Healthwatch Leeds film. Directed by Gemma O'Connell and Ramisa Ahmed. Co-produced by Gemma O'Connell and Ramisa Ahmed. Based on a report produced by Tatum Yip, community project worker. Credits: Primary Editor Gemma O'Connell, Senior Editing Assistant Ramisa Ahmed. Music A Himitsu, Where Silence is Non-Existent, SoundCloud. Video Assistant Operator Dex Hannon. Location: St James Hospital. Feel Good Cafe. Healthwatch Leeds Office. Location Manager Craig McKenna. Equipment Leeds Hearing and Sight Loss Service BID. Healthwatch Leeds. Staff Assistant Craig McKenna. Dialogue Editors Gemma O'Connell and Ramisa Ahmed. Audio Description Dialogue Editors Gemma O'Connell, Georgina O'Connell, Chloe Jowett. Starring Jane played by Jane McDonnell, Alison played by Alison Potts, Volunteer played by Gemma O'Connell, GP Receptionist Ramisa Ahmed, Taxi Driver Anonymous, Voiceover Chloe Jowett. Special thanks to Healthwatch Leeds team, Healthwatch Leeds volunteers, Leeds Teaching Hospital Comms team.